or send in questions. Let's see if I can get that connected. Hopefully you'll be able to see your chatted in questions as well. But a number of you sent in questions, so let's jump to those. I have to look up at my screen to read that. Okay, I had what I suspect was Lyme disease several summers ago, flu-like symptoms followed by a rash. After the flu-like symptoms, a Lyme literate doctor had a Zoom call with me. I didn't test as I didn't think it would be accurate. I was on an antibiotic for a month, took some oregano oil, not consistent, but for a couple weeks. Also took your acute LX and chronic LX, never completed the whole bottle. What could I continue to do to help my immune system? I don't think I have symptoms other than the normal fatigue and lack of ambition. Okay, so if you know you've had um, Lyme disease, so remember what Lyme disease is Borrelia burgdorferi, also multiple co-infections can go along with it. Comes from a tick bite, typically a deer tick. Um, and there's three phases of Lyme disease. There's the acute phase, where that is defined as the bacteria is still in the blood or the tissues, and it is fairly easily killed by using an antibiotic. Problem is it can go into phase two, which is typically known as chronic Lyme. Phase two, by my definition, is that the bacteria has gone inside of a cell. So understand when bacteria get in your body, they're looking to just replicate themselves and looking to, raise a family. So they're making lots of little baby bacteria. Um, and they don't tend to do that in the blood quite readily. Remember, your blood is flowing a river of blood going through your body. So it's not really easy to raise a family in the middle of a river. So they get into the tissues and your immune system is attacking them. So whenever you have a bacterial infection or a viral infection or anything else, you elicit an immune response to kill that infection. Um, so the bacteria are trying to stay alive. Now, Lyme has multiple different ways to stay alive, and I define a lot of those through my books and on our website and some videos on our Lyme course. But once a bacteria goes inside of a cell, this doesn't always happen. Understand, the majority of people that get Lyme disease um, every single year never take an antibiotic and their bodies clear it up themselves. It's just when any infection becomes more virulent, partly due to the strain, partly due to the health of your immune system at that particular moment in time, um, that the bacteria starts to replicate quickly, and now your immune system can't take care of it as well. The bacteria can try to hide and try to protect themselves by going across a cell membrane and getting inside of a cell. Now, your immune system can't kill something that's inside of a cell. So, your immune system just kills things in the blood and kills things in the extracellular spaces. So, once a bacteria or anything gets inside of a cell, it's basically protected from your T cells and your macrophages and your natural killer cell response. It's the immune side, the killer side of your immune system that's trying to kill that. So, to answer this question, if you got Lyme disease, it was correctly diagnosed, you received an antibiotic, you quite possibly could have killed everything. You don't have any Lyme disease anymore. If in a case of where it does get inside the cell, it still doesn't mean your body can't ultimately take care of it. As your body tries to kill that bacteria has to go outside of the cell to replicate, and it can be killed by a healthy immune response. And the person may have been sick, may have had symptoms like this person who asked the question to begin with, and now they don't have any more Borrelia bacteria in their body. It's not there anymore. So they've solved that problem. Whenever you have a bacterial infection and your body killed it, or you used antibiotics to help your body kill it, and it's gone. You don't have the presence of an acute infection anymore. Well, quite honestly, you don't have to worry about it. But with some people, a small percentage of the people that get Lyme, that bacteria can cause other issues. If it starts to replicate in the cell, or it goes outside of the cell and continues to replicate and then hides back in the cell again multiple times, and your immune system is trying to kill it, what happens with your immune system is that then you will create B cells, or you'll have a B cell response or a Th2 response to your immune system. That is the side of the immune system that makes antibodies, and you'll actually make antibodies against Borrelia, which is fantastic. You want to have antibodies against the bacteria, so it can tag the bacteria so that the killer side of your immune system can more readily kill that bacteria. But the problem comes in is when a bacteria continues to hide inside of a cell. Let's say it's in one tissue. Let's just for an example use, let's say it's settled in your thyroid area. So this happens over and over, that you have this Th1, Th2 response in that area. Well, you can begin to make antibodies against your own tissue. So you can begin to make antibodies against your thyroid cells. And once you make antibodies against self-tissue, now you've moved into what I call phase 3. You basically moved into an autoimmune disease. So another way to put it is you have an autoimmune disease caused by Lyme. You have antibodies to self-tissue because of Lyme disease, of Borrelia, or what I call phase 3 Lyme. That's a whole different ball of wax, whole different way you have to treat it. You can't treat it now by stimulating the immune system, because every time you stimulate your immune system, you'll kill that which you have antibodies against. You'll be killing self-tissue. So I guess if I had a history, and I did, so I had Lyme disease several times. I got an antibiotic for it, and I believe that I killed it, and I didn't have any symptoms after I was able to destroy the bacteria. So can you test for, do I still have the bacteria? Yeah, you could do a PCR test to see for Lyme disease, to see if you have the presence of bacteria still. If you do an antibody test for Lyme disease, if you have IgG or IgA antibodies, that's mainly past exposure. You have to look and see if you have IgM antibodies, that you have current exposure, current infection. But if you feel like you've killed it, you don't really have any symptoms from that, we have to be careful not to blame all our current symptoms on a past disease. And we see that a lot with people that have a history of Lyme disease. They say, I have Lyme disease. Well, when did you get it? Well, 10 years ago, and I still have Lyme disease. So they're still trying to find the magic killer substance, nutrient out there that's going to kill this bacteria. Well, at least 9 times out of 10, those people don't have any current bacteria in their system. Well, yes, I do, they'll argue. I've been sick since I had that Lyme disease 10 years ago. Well, that Lyme disease 10 years ago probably moved you to what's called phase 3 Lyme. You have antibodies to self-tissue. That's really what's causing your symptoms, is this autoimmune disease, not the fact that you have bacteria present in your system from 10 years ago. That'd be very, very rare. Again, 9 plus times out of 10, they have an autoimmune disorder from the cause from the bacteria back at that time, and they're actually doing themselves more harm by taking all these immune stimulants. So you have to be really careful with that. I go into detail on our chronic Lyme course on that explains that. I go into detail somewhat in my books on chronic Lyme. My autoimmune course goes into tremendous detail on how to actually treat that. So if you have antibodies to self-tissue, well, how do you know that? You have to do tests. So you have to test for that. So there's different antibody tests out there that you could do through standard blood work. Doing lupus tests, or those are called systemic antibody tests, or systemic autoimmune diseases like NANA tests and things like that. Or if you want to get specific to specific tissue testing, you could do a Cyrex lab panel, Cyrex Array 5, Cyrex Array 7X, where you could get a specific test on whether you have, to help diagnose what autoimmune disease you have if you do have self-antibodies. So to answer your question, I dig into further testing. That's what I would do. You have to be careful when you have past exposure to that to just throw immune stimulants at it, because you could be making yourself worse. Digging into some further testing to figure out exactly what's going on. If you have, it says you have normal fatigue and lack of inhibition. There can be some normal fatigue with, everyday stress and just everyday issues with aging. But if you feel like it's a little imbalanced, more so than your friends or colleagues or family members, then you want to dig into some further testing, and you can contact our office and we can help you with that. Next question, can one use things like the Rife machine or infrared saunas or PEMF if you're on different medications for cancer? Does it interfere with the effectiveness of the cancer drugs? So the Rife machine and PEMF would not interfere with medications for cancer or cancer drugs or chemotherapy or radiation. Saunas might. So saunas increase your body temperature, increase your ability to detoxify and sweat. You will detoxify through your skin with a sauna. Hey, that's the whole purpose of doing a sauna. And if you increase your detoxification pathways when you're on a medication, well, it can detox the medication. So it's going to decrease the effectiveness of the medication. You may need more of that medication. So, you got to beware of that. It's the same thing of taking a whole bunch of things to stimulate your detox pathways. When you're doing a chemotherapy, you could be detoxing the medication or any medication. So if you're doing any medication and now you looked into natural things and I'm going to really support detox pathways and start coffee enemas and do these infrared saunas and do all this stuff that's going to be very helpful for me, because it's goodness sakes, would it be good to help myself detox? It makes a lot of sense. But if you're on a medication, you do have to factor in that, this X dosage of the medication that was working for me doesn't seem to be working for me anymore, because you are increasing the rate of detoxification. If what you're doing is actually helping with your detox pathways, it's increasing the rate of detoxification through those pathways. So you're going to increase the rate of detoxification of that drug. Remember, everything that you put in your body, that you consume, that you absorb, that circulates in your body has to ultimately be detoxified through your liver phase 1, 2, 3 pathways. If you're increasing the rate of function of those pathways, then it goes to figure that you are going to increase the rate of detoxification of those medications. And you will lose effectiveness over time. All those medications have a half-life in your body, and you may want to talk to the prescribing doctor. The Rife is not doing that. So the Rife is actually, if you're using the Rife alongside of chemotherapy, it will actually, in my opinion, help the chemotherapy attack the cancer much more effectively. Now, I don't have any physical data other than just clinical observation to support that theory. But we've just seen that over and over again with people that come to us that are doing chemotherapy, that they found us because the chemotherapy was not working well. We started with the Rife, and lo and behold, the chemotherapy started working real well. Now, was it the chemotherapy that was still not working well and the Rife was killing the cancer? I don't know, but it just seems so coincidental that it's almost every single person that was doing chemotherapy prior to coming to us and getting a Rife, their chemotherapy started working better once they got the Rife. And maybe it's not that chemotherapy is working better. Maybe it's just the rife that was killing the cancer. But I try to think through physiological processes when I'm trying to, decide what will work or what should work or what is working with any clientele. And it just makes physiological sense to me that when you're hitting a cancer with its own frequency and you're causing it to vibrate, you're decreasing the waste layer around the cancer. It's making it more available for medication like chemotherapy to attack it, or even a natural approach to attack the cancer. It's making it much easier for your own T cells and natural killer cells to attack the cancer. So if you're doing chemotherapy and you can't, and the chemotherapy is having a difficult time getting into the cancer, it's not going to kill it very well. So if you can improve that, it's going to work better. Certainly, if you're going to do chemotherapy, you want it to work, and you want to support every way you possibly can to make it work. PEMF, in my opinion, will not affect your medication use in any way. And somebody might argue, well, the PEMF really helps with detoxification. I don't think so. I think the PEMF's real benefit is increasing cell charge. The PEMF uses electrical frequencies where the rife uses light frequencies. So the PEMF really isn't affecting the cancer. It's not killing the cancer. But PEMFs are good tools. So they're great tools for somebody with serious disease. They can help bring energy back to a cell because they help the cell charge. And that's one of the things that was one of the problems with cancer, is that you'll see a person's cell charge go down. You can measure that cell charge with an instrument that measures what's called a phase angle, that measures the impedance across the cell membrane. And there's actually studies that show when you lose that cell charge, that cell membrane charge, that impedance goes down, the survivability of that patient goes down. Well, PEMF can help improve that. So it can be very beneficial that way. Don't think that interferes with any medications, though. Next question. What should I do about high blood calcium levels? Well, I don't know anything about this person who's asking this question. But high blood calcium, so if that's the only thing abnormal on your blood test, and you don't have any known disease, it's like any other test, you have to dig to why? What's going on? So what's the most common cause of high blood calcium? It's parathyroid tumor is the most common cause. So your parathyroid glands right up here secrete a hormone to help you get rid of calcium in your kidneys and retain calcium in your kidneys. When you have high blood calcium, the most common cause of that is a tumor in the parathyroid glands. And you need to get in right away and get that removed. You just have to. It's not something to play around with. I've seen multiple cases like this. Just go in and get the surgery. It's very simple, easy to do surgery, typically outpatient, and you'll get that done. With a person with a diagnosis of cancer, high blood calcium is typically indicative of metastatic disease to the bone. So most metastatic cancers to the bone, when cancer metastasizes to the bone, let's say a person has breast cancer and it metastasizes to the bone, it's typically going to be a lytic cancer. It's going to be a lytic lesion. And by that, I mean the cancer erodes away the bone. And by eroding away the bone, you're going to spill calcium into the blood. You're going to have excess blood calcium levels. If I don't have cancer, and I don't know what it is, I'd go in and get a check. Could be parathyroid tumor. It could be you have primary bone cancer. Primary bone cancer can be lytic or blastic, and could result in high blood calciums. Regardless, whenever you have abnormalities in your blood tests, you should find out why. Figure out why. And it's going to require some further testing. I can't tell you how many people that I talk to on a weekly basis that they send me their blood work, and I go, okay, what did you did this 2 months ago? Did you ever address this? No, my doctor talked about it, but okay, well, why would you run a blood test on somebody if you don't A, address the abnormalities correctly, and B, um, formulate a plan to deal with those abnormalities, and C, retest to see if your plan worked? I don't get it. I'm baffled sometimes. So I see lots of times with cancer patients with it. They have an anemia, and it's like, okay, what did the doctor do about this anemia? Well, nothing. Well, this. I can't even use this blood work. It's 6 months old. It could have changed, drastically in that time. We need to do more blood work and see what's going on now. I mean, remember, your blood work is a picture in time, and it gives you clues of what could be going on. So we want to figure out what is going on, and you have to dig to that reason why. Question came in. I began rifling 8 years ago with the F-117. 3 days in, I felt much sicker. 10 days in, the old injury sites began feel much worse. Than 3 months into die-off, I purged. So question is, I think the question is, because I know the person who asked this question is doing fantastic right now, but when you start rifing for infection, so when you use the rife to kill an infection, especially a gram-negative bacteria like Borrelia burgdorferi, it kills quite quickly. The rife works. And it's very evident when you have Lyme disease and you use the rife machine. If you have the presence of a bacteria, then it is going to kill the bacteria. And if it's a gram-negative bacteria, it's going to elicit what's called lipopolysaccharides from the cell membrane, and you're going to end up with what's called a Herxheimer reaction. So a Herxheimer reaction is when you produce a lot of endotoxins in your body that can overwhelm the immune system in itself, and it can make you feel really yucky. It can make you feel like fluish, fatigue, you just feel really lousy. If that's the case, you need to slow down on whatever therapy you're using to make sure that you can overcome that, because you can make yourself sick. So you have to slow down. Now, I will say that some people will say that they're Herxine, short for Herxheimer reaction, is a very common term in the Lyme community, but they're not really experiencing a Herxheimer reaction. So if you're killing directly with the rife machine, and you're running Borrelia frequencies with the rife machine, and you're Herxine, then that's a sign you had still the presence of the bacteria. And by killing it off directly using the rife, because the rife isn't stimulating an immune response, it's killing directly when it's killing Lyme, you will produce a lot of endotoxins, and the endotoxins produced when you kill a gram-negative bacteria are lipopolysaccharides, which are going to make you feel ill. So that's a sign. If you run the rife and you have chronic Lyme and you're running Lyme frequencies and you have a Herxheimer reaction, that means you had or have the presence of Lyme bacteria still in your body. So then you just got to slow down and go at your pace that you can until you get enough. You killed enough where now you can run a longer program and you don't feel ill. And now you can deal with the comorbidities of Lyme disease. But many people will take immune stimulants. They'll say, well, every time I take, let's say my astragalus or my, vitamin C dose for my Lyme disease, I Herx, and then I have to back off for a couple of weeks, and I do it again for a couple of weeks, and I Herx, and I have to back off for a couple of weeks. And these people were diagnosed maybe 10 years ago. Well, the truth is they may not have the presence of bacteria. They're not really Herxing. They're not killing bacteria, producing endotoxins and feeling sick from that. It's that they may be in phase 3. They have antibodies to self-tissue, and every time they're stimulated an immune system response by taking a supplement, an herbal or a vitamin C or a garlic or something like that, that is a direct immune stimulant. Every time you stimulate your immune system, if you have self antibodies, you're going to kill self tissue. So this quote unquote Herx reaction that this person experiences is actually the symptoms of self tissue destruction. So you have to be careful of that. Again, how do you know that? You have to do testing, you have to run some labs. Another question came in. So thankful to have begun treating with you in 2016. My son bought a F-122 um, from you too. Okay. Or not too. Okay. Well, thank you so much for that. Well, I hope you're doing well, and your son will do well with that too. I think it's good to have a Rife machine at home. Even if you don't have cancer and you don't have Lyme disease, it's a great tool to have to help just in every day. I have a cough or a cold or I'm not feeling well or I have allergies or I just had a patient the other day that has prostate cancer. He and his wife made a call with me because he has to go in and have MRI of his shoulder because he hurt his shoulder. He thought he had a torn rotator cuff or something like that. And he's been in a sling and he's been hurting so bad. He's been taking pain medication and he's tired of taking pain medication. He's trying to figure this out. And I said, hey, you already have a Rife for your cancer. Run the accelerated healing program. It can help with bone and joint and issues like that. He did that. This was 2 days ago, and his wife sent me an email, I think yesterday morning, saying it was the first night she was able to sleep without pain meds, and he slept all the way through. So she was very thankful. So a Rife is a great tool to use for lots of other things. Next question. What Protocell formula is recommended for metastatic breast cancer, or does it depend on where the cancer has metastasized? I have survived stage 3 breast cancer with Protocell diet and detox methods. My husband is a pharmaceutical doctor and has recommended Protocell to some of his patients as well. My regimen in 2007 to 2012 was no supplement or food high in vitamin C. I am understanding that you recommend if a person chooses to eat or take these between Protocell dosages. Is this a more recent change in your program? We have a friend who was recently diagnosed with metastatic breast cancer and is considering this treatment method as opposed to doing more chemo. Okay, so for those who don't know what Protocell is a natural product that's used for cancers, but it's an oxidizing agent. So I'll touch on this briefly, but you can find out more about antioxidants and oxidants on my blog. So go to www.connorsclinic.com and search. I just wrote an article recently. What's it called? Harnessing the... Come on. Let me see. I'm looking up the blog real quick. Because it's a good article. You should read it. Harnessing oxidative stress to kill cancer. That's the name of the blog. So I just did it a couple weeks ago. Harnessing oxidative stress to kill cancer. What is that? What does that mean? So, okay, so everybody's heard of antioxidants. And we need to take more antioxidants. Oh my gosh, we need to take more antioxidants. Take more antioxidants. Well, the truth is that you have oxidation that takes place, and you have an antioxidation that takes place within your cells, within your tissues, within your liver, within your body all the time. We can't get too hung up on that oxidative stress is all bad, because it's not. Everything that happens in your body has to have a balance. So, oxidative stress causes this, oxidative stress causes this. Well, that's true, but oxidative stress is also produced in your body to kill bacteria, to kill viruses, to kill microbes in your body. Oxidative stress is produced as a side note in other metabolic activity, and then you typically produce antioxidants to deal with that. But we can easily get hung up on that everybody needs to be taking antioxidants. And the truth is that cancer patients should really be careful in taking antioxidants. In my book, I write that cancer patients shouldn't be taking antioxidants at all. Um, and why? Because cancer is cells that are in rapid replication. And because they're in rapid replication, they're not replicating super healthy cells. The cells aren't, the mitochondria of the cells aren't functioning, real well. Therefore, you're not making a lot of glutathione, which is your main intracellular antioxidant. And cancer cells themselves are under a lot of oxidative stress. So if you can picture it like that, a cell has a possible lethal dose level, if you could put it on a graph, a lethal dose level of oxidative stress. And if it reaches that lethal dose of oxidative stress, it's going to implode and die. It's going to cause lysis of the cell and destruction of the cell. Well, cancer cells are really close to that lethal dose. A healthy cell isn't. A healthy cell is producing glutathione, getting rid of oxidative agents, reactive oxygen species, reactive nitrogen species, fairly effectively, and that cell is staying fairly healthy. Cancer cells, rapidly replicating, are not producing a lot of glutathione, are not getting rid of oxidative stress. Because they're producing rapidly, they're producing more oxidative stress. So they're real close to that threshold of a lethal dose of oxidative stress. Now, we can harness that. So that's what chemotherapy is. Well, this is the grudge that alternative doctors have had against chemotherapy. You hear comments like, chemotherapy is a poison. Why would you put this poison in your body? Okay, well, in true definition, chemotherapy is a poison because it's an oxidizing agent. So any poison is an oxidizing agent at a certain dose. So yes, we're giving oxidizing agents to a cancer patient. Well, why does that even make sense? Why would you give a cancer patient a quote unquote poison? It makes all the sense in the world from physiology, because you're dealing with a cell line, this cancer that is growing and growing and growing, and possibly metastasizing, that is at close to threshold of lethal death of oxidative stress. How could we just tip it over a little bit and help that cancer cell die? Well, we could give it chemotherapy. That's how chemotherapy works. So we're going to give it just a little bit more lethal dose of oxidative stress, an oxidizing agent, to hopefully tip that over and kill the cancer. Well, the truth is that we could do that also with natural means. And I touch on 4 different nutrients in that article. Melatonin, delta tocotrienol, vitamin E, selenium, and vitamin C at a certain dose. So all those things that I just mentioned would be considered. If you looked up antioxidants, vitamin E is an antioxidant, selenium is an antioxidant, melatonin is an antioxidant, and vitamin C is an antioxidant. There's many more. I just touched on those 4 in that article. But what has been discovered is that at a higher dose of those nutrients, they actually work as oxidizing agents on cancer cells. And interesting, they don't cause oxidation of healthy cells. Kind of cool, huh? So higher dose melatonin, like typically you take 3 milligrams of melatonin to help you fall asleep at night, maybe 6. That's about the dose of melatonin that you would use. But doses of 40, 60, 80, 100 milligrams of melatonin, even up to 200 milligrams of melatonin, have found to be oxidizing to cancer cells and can be that tipping point to cause that extra level of oxidative stress in a cancer cell for it to reach the lethal dose of oxidative stress and cause death, similar to what chemotherapy does. Well, there's other nutrients that have been on the market for a number of years. One of them is Protocell. That's an oxidizing agent for cancer cell. Laetrile is another thing. That's an oxidizing agent for cancer cell, B17. There's numerous oxidizing agents for cancer cells that we use. Now, I have said with some people, so we do cheek swab testing with our patients. Some people test well for antioxidants as well. So I typically, if they test well for antioxidants, if they test for Protocell, then I have them take the antioxidants. That's what this question is about, between doses. But really, for the most part, most of my patients, I do not recommend that they take antioxidants that have cancer, because I'm typically treating them with higher dose of those things, or Protocell, or B17, or something else that is an oxidizing agent, so that we're harnessing that the same thing as chemotherapy. And interesting, these studies were done on these things with a person being on chemotherapy too. So it actually can help the chemotherapy work better as well. So bottom line is, the question is, what Protocell formula, because there's two formulas of Protocell, Protocell 23 and Protocell 50, would you recommend for metastatic breast cancer? Well, honestly, we test people for that. So we get a cheek swab and test people for that. In general, I think more with breast cancer, it'd be more formula 23. With prostate cancer, it'd be more likely to be formula 50, but that's about all I could say as far as in general goes with that. But in general too, with being on with treating cancer anyway, you don't want to be on antioxidants. Or if you're on an antioxidant like vitamin C is an antioxidant, if you take it at a higher dose, it's an oxidizing agent. So just be taking it at the higher dose. Don't be taking it at a low dose vitamin C. Question. Thank you for all you do. What are your thoughts and experience with bladder cancer? Well, just like bladder cancer, just like any other cancer, to me, every cancer is different. Even if, two brothers come in with bladder cancer, okay, we still treat them very differently. So we do a cheek swab, we test for what they need, and they could come up with a completely different protocol. So everybody's unique in our book. So I don't like, here's the protocol for bladder cancer. In my book, that doesn't really exist. So we want to be as specific as possible and test them to see what they would need. It could be a totally different protocol for those two brothers. As far as the Rife frequencies go, the Rife frequencies would be similar, if not the exact same frequencies for bladder cancer. So with any cancer, I just think, obviously, if you look at our website, go to connorsclinic.com, you'll see why we like the Rife. I mean, the Rife is what got me into helping people with cancer way back in the late 90s. And I just think you're just foolish not using the Rife machine while you're doing an oxidative stress, protocol, or while you're doing chemotherapy, while you're doing whatever you're doing. I think the Rife is a great complement to help whatever you're doing work better. So contact us through that clinic. You can through that clinic website if you want. Are there any topical things to do to help with benign tumors that are close to the skin surface? Or what else could someone use to try to get rid of a single solid benign tumor that is a pleomorphic adenoma of the parotid gland? So getting rid of solid tumors. So there's a difference between different tumors, benign tumors. Some can be fluid filled, some can be solid tumors. Can you get rid of solid tumors without doing surgery? So I know a pleomorphic adenoma of the parotid gland is almost always going to be treated with surgery. You're surgically excising that. Is that a bad thing? I really don't think so. What if somebody can't do surgery for whatever reason? What are some other things to do? Can you use topical things? It's going to be very hard for a topical to get down to that. I know people who have used topical things on something that's close to the surface and use DMSO as a driver over that thing. So that is something that you could think of. What would you use topically on a tumor like that? Again, you're just trying to kill that tumor. That would be I mean, without testing that, it'd be really hard to say. I can't really give you a specific thing that you'd use for that. We have used the Rife on benign tumors with actually great success. When I first had a patient come to me and said they had a benign, I think it was a giant cell tumor that was about, I think it was about 13, 14 centimeters large in their abdomen. I wasn't quite sure how it was going to work, how the Rife was going to work, but they had been referred by a cancer patient, and I said, I don't know if this is going to work or not. I wrote a program for it, and it's, I think the last time I spoke there, it was down to 3 centimeters, and it's kind of just been staying at that. So it can work for a lot of different things. So that's one thing I would try if you're like totally against surgery. I do know the surgery for those are pretty simplistic as far as surgeries go, and a very high success rate. Next question, does olive leaf extract stimulate the immune system? I have Hashimoto's, so I generally avoid immune system stimulants. Wise person there. Currently taking olive leaf for sinus problems. Iritis has flared up. Any suggestions for iritis? Yes, olive leaf extract is a direct immune stimulant. It's considered a direct immune stimulant. So again, when you have so some people listening to this are like, what is this person talking about? This person is wise, so they know they have Hashimoto's. So Hashimoto's is antibodies to the thyroid gland. So if you have self-antibodies, meaning antibodies to any self-tissue, you have to be careful using herbal immune stimulants. So, vitamin C, garlic, echinacea, olive leaf extract, it falls into that category. So that's a direct immune stimulant. Why do you have to be careful of that? Because every time you stimulate your immune system, you will kill that which you have antibodies against first, which means you're going to destroy, in this case, your thyroid gland. So you have to be careful with that. Now, can you use immune stimulants? What can I never use immune stimulants if I have, if I have Hashimoto's? Uh, no, I wouldn't say that. In an acute case, so like I got a really bad strep throat, I need to take something, you can take it for a few days. Um, so use it wisely, though. Don't stay on it for a long period of time. Iritis is inflammation in the eye. What can you do about that? Well, um, you got to find out why you have it. If it's just irritation from some external source? Is it an immune reaction because of uh, an allergy? Also, it's not uncommon to have antibodies to different eye tissue. So that's something you may want to look at in testing as well. Remember, once you have antibodies to self tissue like Hashimoto's, it's real easy for you to start developing antibodies to other self tissue. That's why you have to be careful stimulating your immune response. All right, I'll get to some of the questions on the chat here. What to do for 7-year-old recently clinically diagnosed with alopecia, either no symptoms besides minimal hair loss. So alopecia, again, other autoimmune issue. Go to you should pay the $50 to do my chronic disease and autoimmune course, because you have to know. So when you're treating an autoimmune disease, I mentioned multiple times today, you don't want to be stimulating an immune response. But then you also have to look for hidden things. So, okay, well, I'm not taking any immune stimulators, so I'm going to be fine. Well, are there other ways that you're stimulating an immune response? Well, I don't know. How? Okay, if you have antibodies to foods, every time you eat that food, you're stimulating an immune response. So let's say I have antibodies to gluten. Okay, that's a big one. So no, I'm all completely good, gluten-free and dairy-free. I'm eating a really good diet. Okay, well, still really good to do like a Cyrex Array 10, because you'll find out, oh my gosh, I have antibodies to almonds. I drink almond milk every day because I'm dairy-free. Okay, every time you drink that almond milk, you're stimulating an immune response, destroying self-tissue, possibly creating more antibodies to other self-tissue, creating a secondary, tertiary, and so on, diagnosis of different autoimmune disorders. So you have to find the triggers. I cannot overemphasize that. You have to find your triggers. How do you find your triggers? Well, I don't have money for testing. Well, then you're gonna have to do some digging and put your Sherlock Holmes hat on. The best way to find triggers is to do appropriate testing of different antibodies, different food antibodies. So you can have triggers that are food sourced. You can have triggers that are environmental sourced. Okay, if I have allergies and I have a hyperhistamine reaction when I go outside in the spring, that's stimulating a Th1 response. And that's going to make my autoimmune disease worse. So you got to figure out those triggers and try to calm those things down as best as possible. Well, this is very complicated. I know it's very complicated. It is very complicated. There's not. I know because people are looking for a doctor that just says, "Here, all you need to do is take this magic supplement, and you're going to be all better." But I'll tell you, most people have been to 40 doctors that have done these magic supplements of maybe $1,000 worth of supplements, and they didn't work, and they got now a cupboard full of $1,000 supplements, and they don't work because it's a little more complex than that. So, if you take that course, I think that will help you understand that. Hi, any suggestions for low or below normal blood levels of values of iron? Ferritin levels are okay. Okay, like I said before, any test you do, okay, I have low iron, so I should just take iron, right? No. I mean, you got to figure out why you have low iron in the first place. Is your MCV or MCHV? Are your other anemic markers in the functional low range or high range? Is it a B12 deficiency? Is it iron loss from bleeding disorder? Is it iron loss from excess bleeding during periods? Is it you got to figure out why do you have low iron? It could be genetically related. It could be there's just a ton of reasons. So you have to be every time you do a test and there's an abnormal value. So if you do a blood test and there's you tested 50 things on that blood test and there's 4 of them that are abnormal, you have to ask the question why. So why is this off? And it's very rarely as simple as, oh, you just need to take some iron and you're just going to be okay. If you do have primary iron deficiency, you have to ask the question, why do you have that too? Is it because you're not absorbing iron? Is it because you have a damaged gut? Is it because you're excreting it? Is it? It's just a lot of things you need to cover. I hate to be such a pest about this, but don't you want somebody that's going to dig to figure this out instead of just throwing stuff at the wall and hope it sticks? Sorry. What are some holistic ways to deal with HPV? Does AHCC really help? It again, I would. It's not as simple as that. I don't. I've gotten a lot of comments about what's your solution for this or that, and I would honestly suggest you make an appointment with me and we dig to look at your other blood values as well. We just had her go. This must be referring to the 7-year-old. Just had her go gluten-free, dairy-free at 8, and are giving her vitamin C, D3, K2, and a probiotic. Well, I would not give her the vitamin C for sure. Maybe we shouldn't be doing the supplements in case it stimulates an immune response, like you said. Well, the vitamin D3 is an immune regulator, so don't worry about that. The vitamin K2, it should be fine. The probiotic should be fine. The vitamin C is definitely an immune stimulator. With an autoimmune disease, you do not want to be, it's just general rule. If you got any autoimmune disease, you can't be on immune stimulants. Like I said, if acute situation, you could be on them for a short term, but any autoimmune disease, general rule, no immune stimulants. So you go off of that. Good first start to be gluten-free, dairy-free. The only issue that you have to watch out for is that, you go gluten-free, you start eating gluten-free products. Like here, I'm going to eat this gluten-free bread because it's not, it doesn't have any gluten in it, so it'll be good for me. Problem is, it's got a whole bunch of other things in it that you might actually have antibodies against too. So maybe it's the certain other kind of flour, or almond flour, or whatever it is. So you won't know unless you test. Um, so many times people go gluten free thinking, well, that's going to be my solve my problem, and it just brings up other problems. So just be aware of that in your journey. That at some point in time you may want to do a Cyrex panel. I know this person's only 10. Um, Also, it may not be the food itself. It could be chemicals in the food. It could be pesticides and herbicides. I know a lot of people that have gluten sensitivities and gluten antibodies, but they can eat French flour just fine. Um, what's the deal with that? Well, definitely the gluten structure, the gliadin structure in the French flour is different than the flour that we're exposed to, but also it's not GMO, organic. That can make a big difference. I know people that can eat organic gluten foods and not anything that's not organic. So um, that's the Sherlock hat that you have to put on when you're dealing with finding your different triggers. My 77-year-old mother recently had triple bypass surgery and was diagnosed with hemochromatosis. Her GP and cardiologist suggest there's no connection. What are your thoughts on hemochromatosis? Um, I would agree that there's quite possibly no connection. So hemochromatosis is quite common. We used to diagnose hemochromatosis a lot when we did a lot of genetic. There was a time in history when we were one of the only clinics that were doing full genetic, good genetic workups. I was doing, gosh, multiple a day. And I would diagnose hemochromatosis um, because there's a gene for that. Okay, so the reason why a person has hemochromatosis is because of a genetic variant, and tell people that they need to, deal with that, give them some natural ways to deal with that. But almost nobody knew they had it, so it rarely brings symptoms. So it's that's not uncommon, and it could be completely unrelated to the need for the triple bypass surgery, which was blocked arteries, which I would be more suggestive looking at. If the person had to have bypass surgery, you have damaged arterial walls, and then you go, what damaged the arterial walls? Is it high homocysteine levels that was never checked? Was this person never getting blood tested? Was it H. pylori that was never diagnosed, never investigated? Was it chronic Lyme? Was it heavy metals? Those are your three biggies for endothelial disorder, which is what we're talking about there. You said it's called a Cyrex panel to do. It's 7-year-old. You said, is there any other testing, blood work? Yeah. So I'm just throwing that out there. I'm not your doctor. So if you go on our chronic disease and autoimmune site, you'll see the possible testing. Again, talk it over with your doctor. Otherwise, you can make an appointment at our clinic for more specific things to do. Next question that was sent in: can you take Protocell along with some chemotherapy drugs and uh, aromatase inhibitors for metastatic breast cancer, hormone receptor, HER2 positive, HER2 negative breast cancer, and mets to the abdomen? Yes, you can. So again, Protocell, again, this is a totally different person to ask this question. It's kind of odd to get two Protocell questions. It's not most people don't know what Protocell is. So I write about Protocell in my book, and I think I actually interviewed the maker of Protocell for my first edition. Can't remember, that was about 12 years ago. But yes, you can take Protocell with an aromatase. The only thing, I mean, the chemotherapy is an oxidizing agent as well, so it will only complement that. But does Protocell interfere with an aromatase inhibitor, which aromatase inhibitors block hormones? No, it doesn't at all. You can take it with that, so there's no issue with either one of those. And you share cases with hormone receptor positive HER2 breast cancer. Um, I can't really share cases. Breast cancer is probably the most common cancer we see, and we have good results with it. Again, everybody's different. Everybody's unique. So when we do testing, again, you could have two twin sisters with the exact same cancer, and their protocol may test completely different from a nutritional dietary protocol. Um, but everybody's using the right as well. So, okay, well, thanks for being on today. Let's see if we got a couple more questions here. Um, Absolutely, thanks. Thanks for being on. Thanks for asking questions. Remember, try to go and ask your question before the class, if you possibly can. Go to holistichealthhour.com. You'll see all our recordings of all our past classes too. And Dustin does a great job of breaking them down to see if it's a topic you might want to listen to. I know it's not fun to listen to somebody like me for an hour, but you've tolerated it well. So each one of you gets a gold star and a cookie. Just ask Dustin for your cookie. He'll hand deliver it. And if you have other questions that aren't on that, please go to connorsclinic.com. I don't know. We have well over 1,000 blog posts and a really good search engine on that to search. So you just go to that search bar. You can search any topic. We either have a page that discusses it or a blog post that discusses lots of different stuff. So also go to videos.connorsclinic.com. You can get all these sites from our main site, connorsclinic.com, and our YouTube channel, which has well over thousands of videos on it as well. So, all right. Well, thanks so much, and we will talk to you next week. And wish you guys all blessings, and know I'll be praying for all of you.